I'm Paul. I went out of my way to make sure that there was nothing here worth writing down, okay, because I want folks to listen a little bit, and that way we can have a good dialogue later. I'm also known as the Dr. Kevorkian of EHR and meaningful use, as far as large healthcare providers are concerned. We're going to do meaningful use in 5 minutes. I did this in an hour and a half a couple weeks ago in New York. Should you meet meaningful use, and what if there was no meaningful use? It's complicated. We know less about what we're doing than, let me try this in English. There is more unknown about EHR and meaningful use than there is known. And everybody is in a big hurry to go do it. And for the life of me, I don't get it. I just finished EHR strategy, meaningful use strategy for a group of 14 hospitals. They've already done EHR and CPOE. I'll repeat that. They've already spent the money, completed the project. And I raised the issue of, well, what happens if maybe you ought not meet meaningful use? And you could hear a pin drop in the room. And so we did that strategy. And it turns out after they've spent over $100 million, it's going to cost them $25 million to meet meaningful use, 80% of their IT staff over a 3-year period, without knowing what stage 2 is, without knowing what stage 3 is, the implications of reform, what the ONC is going to do, what's going to happen to the payers and pharma and all that other kind of stuff. And I got to the CEO and said, well, everybody else is doing it, and I can't go to the board and tell them we're not going to take the check. So why buy a drill? Is it because you need a drill? No, it's because you need a hole. So you got to understand what your needs are before you just jump into, let's go do meaningful use. So why buy an EHR? It is not for meaningful use. If this was a dartboard up here, and every one of the 4,200 hospitals in the country was allowed to throw a dart against this wall, and we would remove it, so there's just a hole there, and then the next hospital would come up and throw a dart and throw a dart, we'd get a random scattering up there. And then I'd come up and say, okay, here's the meaningful use standards, and I'd throw my dart. The chances of me hitting anybody are 0. Chances of me hitting the wall sometimes are not too good either. But in spite of that, so why would you sacrifice your entire business strategy for a check? This is the camel getting the nose under the tent. This is the legislature saying, we don't care what's in the bill. We just want to sign something. Because once that camel gets his nose under the tent, the camel wants to get into the tent. So why write off your entire business strategy on something that is so ill-defined because somebody's going to write you a check? If they came to Children's Hospital of Philadelphia and said, we'll write you a $20 million check if you paint your hospital pink, they're going to say, you're out of your mind. And that's without even disrupting their business strategy. But here's what they're trying to force on us now. So what's the elephant in the room? It's, should you meet meaningful use? At least take a hard look at that. Because it may be very difficult to undo once you say, well, there's got to be a benefit in this. They put it together. There's one set of standards arbitrarily defined by a group of people that have never done meaningful use in their life, and it's designed to fit 4,200 hospitals that are each unique. So, up, down, undecided. This is what I do in my spare time, is I draw things. Okay, so there's two conflicting models. There's the large provider business model, better care, lower cost, acquisitions, what do we outsource, how do we provide patient relationship management, how do we put it in EHR so it's meaningful to us. When they put in SAP, they didn't wait for somebody out of DC to sit down and go, okay, well here's how SAP is supposed to work from a general ledger and accounts payable and accounts receivable standpoint. People said, we know what it needs to do. Well, it's time to say we know what our EHR needs to do. We pretty much hit on that. Are all your businesses the same? No. So keep the focus on you. Figure out what it is you want to do if you're a hospital. It seems like everybody here is a consultant for the most part tonight, so that's why I didn't put any useful information on the slides. Try and color outside the lines. You know, once everybody gets outside the box, then all that did is move the box. Now everybody's back in the box. So what I'm looking for is some firms that sit there and say, you know what, we're going to do it different. We don't need to be like in the Monty Python skit for hospitals. You know what they bought? They bought the machine that says bing, and they bought the most expensive machine they could find that went bing, because they wanted to have one, because the other hospital had one. Okay? So we don't need to do that. So let's think about different ways to do this business, both from an IT strategy and a business strategy. This is Dr. B. It seems like every time the ONC comes out with something, the world stops. You know, you could hear a pin drop on Twitter. I don't know if that's a good metaphor, but that's kind of the way things are. And my perspective is kind of the Kevorkian guy. You know, the scene in The Wizard of Oz where the Toto pulls the screen back and the man's going, pay no attention to the man behind the curtain. That's what I'm suggesting. So there's a lot of work to do, and it's going to be more difficult if, in fact, what we do is what they're asking us to do. The other thing is 60-70% of large-scale, over $10 million EHR systems fail. Okay? Those that haven't started yet, don't even think about meaningful use, because you're not going to get there. You cut me off? I got 10 seconds? Okay. So, you know, even if you think you're ready to pass the audit and you're one of the handful of firms that has started and hasn't failed, you still got to pass the audit. And then you got to go, oh, well, stage 2, well, that's kind of interesting what they just did to us. And stage 3, I can't meet that. So where's the money? So what if there were no meaningful use? I challenge folks to approach their systems in that manner. Thank you.